time? Okay, awesome. So this is my 3rd year being here, and I'm so grateful to be here, guys. I love it every single year, and every year we have more to say. So a lot of faces look familiar. Who's been to one of my talks before? So a lot of you guys. So hopefully I don't bore you, because I got some people who got some good kind of new updates. So can you guys still hear me?
Yeah.
Okay, perfect. All right, get started. So first, just to give you guys an overview, and again, I know this is going to be an overview for a lot of people, we'll just talk about what necrotizing meningoencephalitis or pug dog encephalitis, what that is, meaning what happens to the brain and what symptoms are we going to see. We'll talk about the similarities to multiple sclerosis, and I think this is what makes this disease so interesting and what we're doing so interesting. So we'll get some updates on that. And then I'll focus a little bit more about genetic risk and testing. I think my opinion may or may not become unpopular, because I feel like the genetics are not going to be very reliable, the more that we're kind of seeing over time. So I'll give you kind of updated numbers that we have from our genetic work. And then we'll talk about what we're doing with our early screening tests and what we do tomorrow for the screening exams, and for anyone available today, that literally is just doing exams, screening for potential risk factors for disease. So we'll talk about how we're doing that. And then most excitingly, we'll talk about the results that we have from our early treatment studies, okay? So just break it down by words. Necrotizing meningoencephalitis, big long word, we call it NME or PD for short. So essentially, if you break it down, the term necrotizing comes from the Greek word necros, so it means dead, so death of the brain tissue. Meningo is referring to the meninges, those are the layers around the brain. Encephalo is referring to the brain itself, and itis is inflammation in the brain. So literally inflammation to the point that it causes death of tissue within the brain and the meninges, okay? And so when we see dogs with NME, by far, in a way, the most common symptom that we're going to see when they have their symptoms progress a little bit, or their changes in their brain progress a little bit, are going to be seizures. And we'll typically talk about the difference between generalized seizures or grand mal seizures. These are seizures where they're unconscious, they're shaking, they're foaming, urinating, defecating, really, really sad things to watch, especially in a little pug. But I'd say a lot of these guys, and this is what you have to watch out for, don't have generalized seizures. A lot of them can have what we call partial seizures or petit mal seizures. And those are seizures where they have a very focal part of the brain that's abnormally firing, and then they have this manifestation just in a focal part of their body. And so sometimes that might just be twitching of the face or twitching of the limb, drooling. Sometimes they can even just space out and then kind of come back and seem more normal. So I'd say that type of seizure is actually probably as common, if not more common, especially in the early stages when they're starting to have seizures. Not all seizures in pugs are due to NME. I know that you guys know this, but we have to remember that other things can cause seizures. And so when we're thinking of young dogs, things like liver shunts, toxins, if they got into something, autoimmune diseases that are not NME, they can definitely get a more broad category of autoimmune disease that's not the same, okay, does not have the same prognosis. Infections in the brain, depending on what part of the country you're in. And then I put epilepsy on here, but I want to let you guys know that epilepsy in pugs is actually quite rare. They're one of our least common breeds to get epilepsy. So if you have a young pug that has a first-time seizure, what I'll see a lot is they'll go into their primary vet and they say, oh, your dog's a 2-year-old pug that had the first-time seizure, probably has epilepsy. Let's just wait and see what happens. Probably not. Chances are that's not epilepsy, okay? So rare cases they'll have that. When we're thinking of older dogs, keep in mind that older dogs very rarely get NME. So reports of dogs that are greater than 8 years of age, very, very uncommon. So that's much more likely to be due to something else. So things like brain tumor, strokes, other things. And so other common signs of NME in pugs, so sometimes they're going to have this coming on the same time that they're having the seizures. Sometimes these will be the symptoms that are going on before they ever have any seizures. And so these are things to really kind of keep an eye on for at home. And these are some of the things that we are picking up on in these early screening exams before they manifest as seizures, okay? So those can be things like just being lethargic, changes in their behavior, they're not as bright and bubbly as they normally are, sleeping more than usual, not seeing normally, and so this doesn't necessarily mean they're blind, but maybe they're getting closer to things on one side than the other, not catching things as well as they used to. Circling can be one thing as well. Sometimes this can be subtle. They don't have to be going in tight circles. Sometimes you just tend to wander more towards one side than the other. And so again, keeping in mind, these things oftentimes are going to come before we're going to see the seizures, but they can be hard to notice. And so trying to kind of figure out why this disease occurs, we know quite a bit. There's still a lot more that we need to learn about. But we do know that it is an autoimmune disease, so essentially the body is attacking itself and setting up inflammation in the brain. So we know in these guys that there's no evidence of infection, so we don't know of an obvious bacteria or virus that's triggered the disease. Oh, I can wait till people trick it a little bit. No worries. And then as far as why does it happen, a lot of people ask me, like, well, why do they have an autoimmune disease? What triggered it? And sometimes we find a trigger, sometimes we don't. I'd say that there's a growing theory right now in both human autoimmune diseases and autoimmune diseases in animals that the inflammation likely does not start in the brain. Likely it's present elsewhere in the body. So they have something in their body that's triggering them to be inflamed. And so one of the things I'm not going to give too much detail about today, but that we look at is to see, is there anything going on systemically? We call these systemic biomarkers of inflammation that are going on. And oftentimes that's probably going to precede the inflammation in the brain. So it'll be going on in the body, it'll then cross into the brain and trigger this inflammatory reaction in the brain. You figure there's a long time that that's going to take to happen, right? So it's probably this stuff is brewing for a long time before they manifest any symptoms. In some cases, we have known internal triggers like known immune diseases. So things like allergies, we know they commonly get allergies. Oftentimes see dogs when they're kind of flaring up with their allergies, might be more flaring up with the inflammation in their brain as well. GI disease is another common trigger for inflammation in the body that could go into the brain, okay? And then we think of external triggers, like something we put in the body that could have triggered a weird response. So things like vaccines potentially, other medications that they might have had a reaction to. But unfortunately, in a lot of pugs, we don't have any obvious trigger for it. And so looking at different risk factors, a lot of this stuff I'm going to give you is based on kind of older data that's been published. So again, things I think are changing more that we learn kind of more about these guys, but at least age is something that's pretty reliable. Typically, they're going to have their onset of signs between 1.5, 2.5 years of age, or at least by that period of time. So some are going to be a little older, some are going to be a little bit younger, but most dogs you're going to see them by 6 or 7 years of age. So if you have a dog coming in older than that, again, much less likely that they're going to have NME. Females, more common than males. The reason for this is there's a lot of immune genes associated with the X chromosomes. This is a common theme that we see in humans as well. Human females, right, are more prone to autoimmune diseases than males, unlucky females. Fawns, most likely to get the disease. And then at least what we've seen looking at both color and genetics, usually black males, especially black low-risk males, are probably going to be least likely to develop the disease. And so the reason this disease is so devastating, if anyone's ever had a pug with it or has known anyone who's had a pug with it, is that it just doesn't respond to treatment. So the standard treatments that we have for NME are mainly to suppress the immune system, right? So we give them steroids to reduce inflammation, suppress the immune system. We give them other immunosuppressive medications. One that we use most commonly is one called Cytosar, which I'll talk about because we're using that for the early dogs as well. But when you use it when they have advanced disease, it does not work for very long. And then other medications like anti-seizure medicines to try to control seizures. And so the problem that we have is that for most pugs, by the time it's diagnosed, if they're coming in with those symptoms, you're already too late, right? You already have this death, within the brain that you can't recover from. And so looking at survival times, even with aggressive immunosuppressive therapy, we're usually looking at weeks to months before they're going to die, unfortunately. And a lot of that's because of the seizures. They can be so hard to control. And if they're already prone to breathing issues, that with the seizures, sometimes they're going to go into respiratory distress. It's really heartbreaking. And so now we'll talk about similarities to multiple sclerosis. I'm not going to give a ton of detail, but this is really, really interesting connections here between NME and multiple sclerosis. So for those of you who don't know much about MS, the most common autoimmune disease in people, okay, currently affecting 2.9 million people worldwide, very, very common disease. And there's various different forms of it. By far and away, the most common form is what we call the prototypic form, and they have different phases to that we'll talk about. They have a preclinical phase before they have symptoms. They have kind of relapsing, remitting, kind of waxing and waning signs, and then they have a secondary progressive phase where they just continue to get worse. Some people will not wax and wane, they'll just gradually get worse over time. There's a small subset, 10% of people who have MS lesions that don't ever manifest any symptoms at all. And then the lowest percentage is a form that's called the fulminant form. And this form is almost identical to what we see in the advanced stages of NME, okay? And the most common variant of that is called the Marburg variant. So I'll show you some pictures of that. And so looking at what happens with people, if we kind of start at the beginning phase at phase 0, basically going from phase 0 to about phase 2 there, people have MS, they have stuff going on in their brain, but they're not really manifesting any clinical symptoms at all. They're living pretty normal lives, okay? And that preclinical phase is unknown, but it's suspected to be anywhere between 10 to 15 to maybe even 20 years that they have the pathology going before they develop symptoms. And then when they do develop symptoms, going into that relaxing remitting phase, the earliest symptoms can be very subtle and difficult to pick up on that they're related to MS, okay? So most common things would be blurred vision, having a pins and needles type of feeling, numbness, tripping, like they're walking and they stumble. I actually have one of my best friend's sister was just diagnosed with MS a couple months ago, and she actually got it not too long after having COVID, so they think that might have triggered it. But she was having this tingling feeling in her fingers that was going on for a couple years. And at first she was like, I don't know what this is, something's weird with my fingers. She saw her doctor multiple times. She was in rehab for a long period of time. Eventually progressed to the point where she really was having trouble with her 3 left fingers. Finally got referred to a neurologist. This is now 3 to 4 years later, and she had multiple lesions consistent with MS on her MRI. She's 47. She's got two young kids, so it's just devastating disease. And so again, just like with people though, these symptoms are subtle and don't get picked up on for quite a while. And so ultimately with people, they're gonna progress to the point where they're extremely disabled, having trouble moving, walking, ultimately become bedridden and die of disease. So a little bit of a different, progression that we would see with NME, but very similar as far as what's happening with the pathology with people. And similarly with people, if you treat them in the early stages of the anti-inflammatories and immunosuppressives, it can help slow down the progression, but those treatments are also ineffective to cure the disease. And in people, there's a very strong push to try to get them as early as possible to try to see if they can get therapies that are going to be more effective. And so this is kind of another little graph just to show you what's happening with them. So what I want to focus on is this preclinical phase, because this is what we're kind of trying to pick up on our pugs, this preclinical and early clinical phase. And so if you look at this chart, you can see we've got this line here, this green line is clinical disability. So you can see that preclinical phase, they don't have any symptoms at all, right? But if you look at the bottom there, those little spikes are referring to new MRI lesions that are forming inside the brain. So you can see in that early stage, they've got a lot of MRI lesions that are forming. So they call that phase radiographically isolated syndrome, or RIS. So they're already having a lot of changes in the brain, but not having anything happen clinically. And so that preclinical phase, again, probably 10 to 15 years in a person before they move on. And then through that relapsing remitting phase, you can see they get much, much worse as far as their clinical disability. The disease burden in the brain gets quite a bit worse. But towards that end stage, that secondary progressive stage, they don't have a lot of new lesions forming. They just have a lot of degeneration of what's already there. So if you try to catch people there, you're way too late, right? You got to try to get them in this preclinical and early clinical phase. And so interestingly in people, if they look back though at people that have been diagnosed with MS and compare them to age-matched controls as far as how well they did in school as children, they'll oftentimes find people with MS didn't score quite as well, and chances are they were probably already having some early cognitive changes that just weren't picked up on, even when they were children. So, and then interestingly, looking at autopsies in people with MS, 25% of them haven't had any symptoms, and so obviously they were starting to have changes before they showed anything clinically. And so why this is so interesting for us, in addition obviously to trying to save our pugs, is this similarities between NME and MS are very, very strong, okay? So we have basically the same sort of risk factors as far as being most common in females, being most common in young people, and obviously young pugs. There's a race color distribution, so it tends to be Caucasian people, and it tends to be fawn pugs. They're both light, I don't know how close that is, but I like to say that's a correlation. This predisposition to having immune diseases is a strong risk factor in people. So either already having other autoimmune diseases or having what we call a pro-inflammatory signature. So they already have stuff floating around their body, inflammatory cytokines and other markers that are abnormal people. And we've seen similar sorts of things to some degree with some of our pugs. So I didn't have enough time to give you all that detail, but again, we think that there's going to be a link there. And then genetics. So I'll talk about genetics. That's probably one of the stronger connections as far as that being a similar risk factor in humans and in pugs. But keep in mind, in humans, only 60% of them are going to have a genetic risk factor. So 40% of people don't, have any specific genetic risk. Okay, but when we do look at genetic risk, the location of that genetic risk is very, very similar. So if you look at humans, they have a part of their genome called a human leukocyte antigen. Dogs have a similar one called a dog leukocyte antigen. It contains a lot of immune genes. So the region that humans have mutations that trigger MS is a very similar region to what we see in pugs, okay? And a lot of the genes there are helping control T cells. So it's a type of lymphocyte that helps trigger inflammation. And so in humans with MS, alterations in that T cell pathology is a big trigger for it. We think it's very similar in pugs, and so that's probably part of the reason for developing disease. So that genetic stuff has been pretty well established by multiple groups. So this, I think we can believe it. I'm not saying I don't believe in what they found for sure, but it does get pretty complicated. So just for you guys to kind of understand what the genetic tests mean, and when you're submitting, if you submit the test today, it's like, what do these letters and stuff even mean? And so what we know is there is this group of mutations that has been associated with NME in a group of dogs, okay? And so when you have a genome, you have 2 chromosomes, right? And so you have the potential of having that abnormal group of mutations on 0, 1, or 2 of the chromosomes, okay? So pugs that don't have either copy of that group of mutations are considered low risk in this particular type of genetic testing. And again, that's not gonna represent everybody, right? If they're medium risk, they have 1 copy of that abnormal group of mutations, okay? And if they are high risk, they have both copies, okay? The reason I'm gonna say maybe my opinion isn't popular is that the more dogs we've tested over time, I don't believe that these percentages are fair enough, okay? So what's kind of been published, or at least reported, is that 72% of dogs with this high risk mutation or high risk haplotype are gonna get NME. I just don't think that's the case, and I'll just let you know what we've seen with the numbers. And so far our numbers are higher, than the numbers that they tested earlier, okay? So this is just showing our numbers. So a lot of these dogs are in our population, so I will give the caveat that I do think there's probably gonna be different populations throughout the country that are gonna have different genetics, right? But if you at least look at the dogs that we've screened in Colorado, we've screened 106 dogs so far genetically. 46% of them have been NN low risk. We use a different genetic test. It's not technically NN, but I just wrote that for you guys to make it easier to understand. 36% medium, 18% high. So 54% of our pugs have at least 1 copy of the abnormal haplotype. Okay, that's high. Over half of our population is considered at risk, right? But then if you break down the high risk group, we have 19 of those dogs so far. 2 of those dogs had NME, and 3 have the early form of NME that we're training. But even totaling those, that's 5 out of 19, that's 26% of the high-risk dogs that we've seen so far have had any association with NME, and we've had some medium and low-risk ones who we think have. So I just really don't know how much we can trust it. I think we can use it in association with other things, just like they do in people, to help determine potential risk factors, but we have to be looking for other things, okay? So just to kind of go back to these similarities between NME and MS, this is a paper that we published last year that just shows MRI images. On the top is a dog with NME, and the bottom is a person that has this Marburg variant of MS, and it's both the clinical picture, MRI, and the pathology is almost identical. So again, in people, this form tends to affect younger people, very rapidly progressive signs, usually have seizures, usually going to fail therapy within days to months. And then if you look at the MRIs, you can see on the left there, that's an image that helps us show necrosis. So that kind of white area there is where they've lost enough brain tissue that it's filled with fluid, okay? So that's that on the top right there. You can see all that white. And look at that person on the bottom. Same location, same pattern as far as seeing that necrosis in the brain. And then looking at the right, we have contrast enhancement. This is where we've given contrast IV. It leaks into places where there's a lot of inflammation. Again, location and pattern almost identical. You know what we see with dogs with NME and humans with this form of MS. And so a lot of the reasons we started doing kind of the big part of our work is then asking the question, like, are we missing something, right? If there's different variants of MS, is it possible that there's, an earlier stage of NME that we're just not picking up on because we're not screening them, because they're in this preclinical phase where they're running around like happy pugs, and people aren't noticing anything at home. And so we know if we diagnose it at the time, it's too late, right? Their signs are going to be irreversible. But if we catch early, before the necrosis begins, is there something we can do to kind of prevent it from happening? So that's what we've been working on for the last 3 or 4 years now. And so essentially the main component of that is going to be start screening them early. I 100% think now that screening them with neurological exams, that's literally just a simple exam, is going to be more reliable probably than the genetic testing. I think we could use it together, but I think this is going to be our way to really try to screen them, okay? And then to start treating them early. If they have a single seizure, we have dogs in our study that literally had one seizure, and we can see the necrotic lesion early in the brain. So instead of sending them home and waiting to see what's happening or just starting medications, get them started treated, right away. And then our hope is to see that these changes are going to be reversible. I'll show you some images of some dogs that we've seen that's been the case. All right, so now we'll talk about the early screening studies, which you guys can all be a part of later today or tomorrow. This is real simple. It's really us just kind of doing an exam. So this is just kind of giving us what? Oh, you want the last one?
Oh, the last one.
This one?
Pass that one more.
This one?
Keep going the other way.
Other way?
Keep going.
Now I'm getting back to where I was, so.
That one.
Oh, that one I've had up several times. So it's
Kind of pop through that one.
yeah, sorry. I'll go slower. All right.
Thank you.
No problem. So this is just to give you guys a diagram of what we're doing with this trial, okay? It's been going on since 2021. We screened 56 pugs here last year that got to be part of it, so we're really grateful for your guys' help. And so essentially, to be eligible, you just have to be a pug. You have to be up to 6 years of age, because we know past that, the likelihood of getting the disease is quite low. No prior history of other neurological diseases, right? So if you have a history of epilepsy, you've had a shunt, you've had a back surgery, it makes it hard for us to interpret the exam. So we don't use those guys, but there haven't been a lot of them in that younger stage. And then we do accept dogs that had seizures that are recent, right? That's obviously a sign of NME. And so really simple at first, we just do neuro exams for patients that we have in the clinic. We're genetically testing them for NME. That's not something we're doing here at the show. It's really just to do the screening exams, okay? So no swabs, no blood work or anything. And then what we're doing for our dogs at home, and we did have a couple dogs last year that we followed up on. If they do have changes on their exam, essentially we just need to make sure that's consistent, right? Sometimes they have a weird day and they're not doing stuff totally normally, and you check them a little bit later and they're fine, right? I will say every dog that we've had enrolled in the study has had signs that were progressive. So they were abnormal on one exam, abnormal probably a little worse than the next. We saw them getting worse and worse over time. So this was just like a one-off thing, okay? So for the ones that are normal, we kind of just keep an eye on them. We have had dogs that are in that high genetic risk group that we're just keeping a closer eye on. We check them every 3 months or so. The other ones, we're just having them keep in touch with us. For dogs that are abnormal, and again, these are dogs that are abnormal multiple times, we know it's something consistent. Those dogs, we're doing an MRI, looking at spinal fluid to see do they have any sort of early signs of NME, and make sure they don't have something else, right? Sometimes these guys are born with structural abnormalities that affect their exam, and we could say, hey, your dog doesn't probably have early NME, but it does have hydrocephalus or it does have other stuff going on in the neck and back that'll probably make that exam look a little abnormal, unlikely to progress, but we just kind of know that that's going on. And so for ones that don't have any of those structural changes and have some of those early changes on the MRI, we've been enrolling them in our early intervention studies, and I'll give you guys the results of all that stuff. And so far, with just the screening as part of the study, we screened 136 pugs so far and have found 14 pugs, so about 10% of them that have had almost identical neurological symptoms. And I'll tell you, it was really creepy, honestly, when I first started doing this, because we designed the study and I was really skeptical. I was like, okay, so we're just gonna sit there and examine a bunch of normal pugs? Okay, like that sounds fun, but I mean, it felt like it was gonna be pointless and we're gonna move on. And so the fact that pretty quickly we started saying, hey, no, there are some of these guys that are normal that have something that's not normal on their exam, and that thing is the same, and that thing is repeatable, and that's happening over and over again with multiple pugs, let us know we're probably onto something. And so what's most fascinating is not only the reproducibility of it, but these symptoms are basically identical to what you're seeing in humans with the earliest stages of MS, okay? And so the things that we've seen in all the pugs are kind of diffuse neck and back pain when you put pressure there, they don't want to be touched. Very similar to people having these weird sensations. They don't want to be touched. They're having weird pins and needles types of feeling, sensitivity. Paw placement abnormalities, which I'll show you a video of, where you flip their paws over, they just don't quite know where they are in space. That's very similar to people in the early stages where they'll intermittently trip because they suddenly didn't know where their foot was. Visual processing deficit, so oftentimes these are not things that people necessarily noticed at home, but I'll pick up on the exam, and then if they look back, like, you know what, actually, she's been into the vet twice in the last few months because she scratched her cornea because she bumped into something. Well, why did she bump into something, right? So, and people are like, oh, I actually didn't notice that she can't catch as well as her brother does, and I just thought she was different, you know? But for a lot of them, once we started treating them and they got better, they realized that those were symptoms, you know, that they had. dull demeanor in a good percentage of them. And people, again, mainly notice because they got a lot better after we treated it. And then we have about half of them that have had seizures within the preceding weeks of coming in. And so this is just to show you guys what I mean by that paw placement, this little dozer here. Just to show you the flag, sorry. That's just to show you what that paw placement is. We flip that over and he just does the process where his foot is in space. I'd say that's one of the more common symptoms that we see. They walk totally normally, but they're definitely not processing it. It's almost always on one side than the other. Sometimes it's both front and back on the same side. Sometimes it's just the back. And then if we break down the dogs that we've seen, again, of these 14 dogs, our distribution of genetic risk is a lot more variable, right? So we have about a third of them are in the low risk group. And I will say with those low risk groups, we do have, you guys will see pictures, so you'll call me out on it, I know you'll notice, is that we're getting some like chugs in there. So we have a little chihuahua in there, they're coming like, this is my pup, this is my pup. That's not Pug. Like, that's not a Chihuahua Pug. So, but the Chihuahuas are another breed that are high risk to develop NME. And so at least if you're don't have a purebred pug and you're getting some chug in there, I think the reason that their genetics are probably not faring out is because they're different, right? They're not purebred pugs. So, but 36% low risk, 43% medium, and then 21% high risk. And so wanted to show you guys what we're seeing with the MRI changes in dogs with early NME. Again, almost identical to what they're seeing in people in the earliest stages of MS. So again, this is out of a paper we published last year. If you look at the top image here, we have a pug. That the arrows are kind of pointing to those kind of whiter areas where there's inflammation in the brain. You can especially see it with that lesion on the right side there. And then this is a human who is in what we call clinically isolated syndrome, meaning they've only had one single episode that could be associated with that mass, and they just MRI'd them at that point. And so again, the pattern of the lesions, the location of the lesions is very, very similar to what we're seeing in pugs in this early stage of NME. And so what we're trying to do here, and you guys can help us, is to really change the concept of NME. Okay, so historically it's been thought about, at least by neurologists, of you have this brain necrosis, you get these symptoms, you try to treat them, you have days to weeks before treatment fails, and then you die of disease. What we want people to try to think of is this new concept of early NME, where you have stuff that's preceding that brain necrosis for a very long time. So you probably have some sort of systemic inflammation going on. There's probably some sort of systemic inflammatory biomarker that we can hopefully identify in the blood that might indicate that they're at risk. At that point, they can get some transfer into the brain, get inflammation in the brain, and then start getting some early lesions. So I don't know if you guys can see it on there, but this is one of our early pugs. This little white thing right there is an early necrotic lesion in that dog. So if we start treating them there at that early NME stage, are we able to stop it then? Can we stop them from progressing to developing the brain necrosis and ultimate death? And I'm thinking that we're going to be able to from what we've seen so far. And so we'll talk quite a bit about the treatments that we're trying to do, but wanted to give you the background as far as why we're doing what we're doing. And a lot of this is really trying to shift the way we think about treating autoimmune diseases in general, but certainly this disease. And this is following a lot of what they're trying to do in humans as well. And so for humans with MS, they know that suppressing the immune system ultimately doesn't work. And so what they're trying to do is shift away from suppressing the immune system to modulating or essentially resetting the immune system. Let's get the brain to be normal instead of just suppressing the brain, okay? And so a lot of those methods are aimed at trying to promote healthy repair and regeneration of tissue there. And so again, important to catch them early. If you have a really damaged brain, it's a lot harder to do. But one of the main things that they're trying in people is to use stem cell therapy. And we'll talk quite a bit about what we're doing with that. Definitely have seen that it's been able to reduce the severity of signs in people with MS, slows their time to death. But it's really difficult to do studies in people for stem cells. So if you look at the kind of induction of stem cells, they're really quite young. They've not been used for very long. And so if you look at the MS literature for stem cells, probably over the last 10 to 15 years. If you look at the natural course of MS for a person, oftentimes you're looking 30 or 40 years. They don't have enough time to be able to follow them and be able to publish a lot of that data, okay? And so that's why the pugs are such an amazing model, because we know this is a breed that gets this disease by a young age. We know it's this breed and we can screen them early and we can follow them over a short period of time. So we have the ability to do these studies in a much shorter period of time to give the results of how stem cells are working in our guys, so which makes it really exciting. All right, so I'll talk about early treatment studies that we've done so far, okay? So we essentially have two groups. Our goal for pretty much all of them, and this is going to be able to be the case now, is to do intravenous stem cell therapy. So 11 of our pugs have gotten that, and again, the goal of that is more of an immunomodulatory reset the immune system. We have had 3 pugs that right off the bat got the typical autoimmune drug cytarabine, and they were earlier on in the study where we didn't have the stem cells as readily available, and now we have it down and have them very readily available, and so we're not doing them as the first line of therapy for any of them. But I will say that the stem cells don't always work for everybody for a long time. And so if we've had pugs where they either didn't respond as well to the stem cells or it didn't last as long as we wanted, we've had some of those that we've converted then into the cytarabine arm. So all together, we've had 7 pugs that have ended up getting cytarabine. And that's a drug that's typically quite well tolerated. We usually give it as an injection underneath the skin every 4 to 6 weeks. So I'm the lucky one that gets to see them come in, every 4 to 6 weeks. And then usually we'll combine it with just a very low dose of an anti-inflammatory steroid. And so what I will say with all of the pugs that we have so far, 14 pugs, all of our pugs are markedly improved, some of them back to normal. So huge, huge improvement in their exams. And I'll show you some examples of what that's looked like, okay? So first I just want to give you guys a background about stem cells though, because people talk about stem cells all the time. Before I did a lot of stem cell work, I'm like, kind of think I know what I'm talking about, but I don't know what I'm talking about. Like, what is a stem cell? So there's various different types of stem cells, and so you'll hear about a lot of them when you're referring to like embryonic fetal tissue stem cells. So these are stem cells that are taken at the embryonic stage or fetal stage. Those cells have the potential to kind of, especially the embryonic stage, kind of become anything. When you're looking at the fetal stage, depending on the stage that they're in, they're usually going to be able to form the kind of 3 main lines that form all the cells in the body, okay? So those are the endoderm that ultimately becomes like your soft organs, lung, pancreas, things like that. The mesoderm, definitely the most common, so if you're going to remember one, that's the one to remember. Okay, mesenchymal cells or mesoderm line, they're going to form most of your tissues in your body. And then you have the ectoderm line, so that's going to be your skin. Interestingly, that's your neurons as well, but it's really hard to kind of form a neuron from an ectoderm line. So I'd say for you guys to remember, the majority of cells that are used in humans and in animals are coming from adult stem cells, okay? So we're kind of coming from this multipotent stage and beyond, okay? So unipotent stem cells, much less common because they're very restricted with what they can do. So just kind of remember that this mesoderm, mesenchymal cells, most common. And then the other important thing to think about is kind of where they're coming from. So autologous stem cells are coming from the organism that's getting them back, okay? So they have some advantages to using autologous stem cells, less likely maybe to have a reaction if you're getting your own cells. But if you think about it logistically, like, do you really want to give cells to someone who's sick in the first place, and that's why you're giving them cells? So a lot of people have gone to using autologous stem cells just because they're probably coming from a healthy individual, and it's a lot easier to kind of control the quality of those stem cells. So that's where the majority are going to come from a healthy donor. So we've used 2 different sources of stem cells. Originally, we were working with UC Davis's regenerative medicine lab using stem cells that came from fat, and so they kind of cultured them fresh and shipped them over to us. But a lot of logistical issues with getting them when we needed them and stuff, which is why we moved on to working with Gallant Therapeutics, they're an amazing stem cell company. And so they also use stem cells from healthy donors, and they use uterine-derived stem cells. So essentially, animals get spayed, donate the uterus, and they're able to grow the cells from there. And so the nice thing with them now is we just call them when we need them. They send them over to us in a little freezer. We thaw them. We give them right away. So we have them whenever we need them. And so it's really amazing how stem cells work. I'm drinking the Kool-Aid, I'm not going to lie, because I've seen what they've been able to do, how quickly they can work. And so they're known to kind of be the paramedics of the body. So you can give them, and we found that they're very effective giving them intravenously. You don't have to necessarily inject them into the area of damage. If you give enough stem cells, and they're good quality stem cells, they are able to hone into where they're supposed to go, okay? And I will say the caveat that we use very good stem cells and we use a lot of them. So our dose of stem cells is 10 million cells to 15 million cells. That's a lot of stem cells. So so if you try to look for some commercially, sometimes you might have like 300,000, so much, much lower dose than what we're using. But they're able to get to where they need to go. They recognize areas that are damaged. They're able to alter the immune system locally there and systemically to help reduce inflammation. They can alter the cells in the system, the T cells and B cells, to get them to be more normal in number and function. They can get new blood cells to form. They can help inhibit scar tissue formation and cell breakdown. So really, really amazing what they have the ability to do. And then they can actually recruit other brain cells there to kind of do a job to help divide and repair the tissue. So really quite amazing. So I wanted to tell you guys about some of these. These are our dogs that are in the STEAP trial, or stem cell therapy for early encephalitis in pugs. We've had 11 of them so far. I wish I could talk about all of them and give them all their due deserved attention, but that would, as you guys imagine, take many more hours than I probably have. But we love them all. We see them all very regularly. You can see what I mean with some of the chugs sliding in there. But I'll tell you about some of their stories at least here. So just to kind of tell you how this trial goes, essentially any dog that's abnormal multiple times and has those abnormalities on MRI CSF can qualify for the stem cell trial. And so they get a round of stem cells. We check them the next day. We check them a couple weeks later. Then they get another round of stem cells. And then a couple months later, we recheck their MRIs to see if things have changed. And we've had actually 2 pugs that we've given a 3rd round of stem cells to, so we're changing things a little bit, but at least that's kind of the basic for most of the pugs what they'll get. And then we kind of determine whether or not they're responding to it. If they've gone through the rounds and they responded, we recheck them every 3 months. And then if they haven't responded, for whatever period of time, sometimes it's right away, we can tell it's not working, sometimes it's after several months. You will either usually try to give them another round of stem cells, or ultimately we've treated some of them with cytarabine instead. So first 8 pugs, we got those stem cells from Davis. Our last 3 pugs have gotten the uterine-derived stem cells from Gallant. And they've really been tolerated great. I mean, they come and they hang out with us. Usually they're sitting in the arms or laps of our nurses that are getting them. They go IV, they just get them slowly, they get fluids, and then we just monitor them for reactions to it. So we've only had 2 reactions so far. They were both pretty mild. One was one of our pugs broke out in a hive. She's like a very bad allergy pug, and her name is Spuds, and we ended up moving her to the cytarabine arm. None of the other pugs have any other reactions in that way, but she gets hives from a lot of things too, so it wasn't too surprising. And then we had 1 pug that just vomited once, and we gave her an anti-nausea medicine, and she had no other issue at all. So it's tolerated really, really well. And so I wanted to kind of show you guys what actually happens with them, because it's really difficult when you're talking about responding and not responding to show you guys how dramatically they actually respond. And so we developed this scoring system, which has been a way for us to essentially give them points for changes that are abnormal on their exam, and we kind of track those points as they go up and down over time and with what treatments we give, okay? So this is just an example of one of our pugs, Waddles. So when he first came in, he was actually scheduled to be part of the SEEP study just as a regular screening exam, and then 1 week before his appointment, he happened to have a seizure, so thank goodness he was kind of already scheduled to come in. And so he was one where he had that abnormal paw placement in one of his back legs. And I'll show you a video of him. He had pretty severe neck and back pain when you tried to put pressure on his neck and back. And so again, and had that seizure. So we rechecked him kind of before he came in for his MRI. So you can see we have kind of spot number 1 there is his first exam. Spot number 2, this is not very long after. This is in a week or 2 that he came back. We have his exam looking quite a bit worse, right? So his paw placement now is actually absent in the left front leg and left back leg instead of just being slow in the left back. And he's got severe neck and back pain again persistently. And so this kind of next phase is right before he got the stem cells there. So that's the day of getting the stem cells. This green dot right here is 24 hours after getting the stem cells, how quickly he got better. So at that point, he had much, much better in pain. So he did have a little bit of pain in the lower back, but overall much improved. And then he still had that absent paw placement in the left back leg, but the left front leg was normal. So that's, again, 24 hours later. He regressed a little bit by his 2nd visit. We've seen this not uncommonly, which is why we give them 2 rounds of stem cells. They often need a 2nd round, where his pain was a little bit worse. But you can see again that green dot after 24 hours, how much better he was. So they work super, super quickly. And then he even got a little bit better after that. When we saw him 2 weeks later after that 2nd round of stem cells, that pain was gone. And now he's just kind of had this that come back a little bit and has stayed pretty consistently, just having that slow paw placement. So again, his exam is it's normal now, but it's much, much better than it was before he got the stem cells. So this is just to show you, hopefully our sound comes through here, what I mean with that pain on exam. stem cells, okay? So big difference, and we'll see that dramatically, I mean, within a day. It's really remarkable. So I have a colleague who's very skeptical, and he's like, how do I know that you put the same amount of pressure on both ones? And I promised you that I did. And I was like, I'm gonna start telling people that because of you being skeptical, but it's really, I think that's some of the symptoms that gets better really dramatically. So this is just showing you another example also. I'll show you his MRI findings as well. He's a dog, again, came in with seizures, a lot of changes on his exam. 24 hours post stem cells, he dropped dramatically. So just had a little bit of a reduced blinking in the left eye. That stayed pretty consistent. And then started having a little bit of a relapse before his second run of stem cells. Got back to totally normal 2 weeks after his second run of stem cells. But they kind of waxed and waned, just not having as good of a blinking response. That went on for months, you know, so he came in really quite bad. Went months and months and months, and it was basically 16 months after that we noticed a big change where he suddenly came in again with seizures. A lot of the symptoms that we had seen initially came back, and we rechecked his MRI at that point. So I'll show you guys what that looks like. So this is going to be on the left here is his original MRI. So this is the one I showed you before, just for consistency with those lesions. So you can see those changes kind of both on the top and the bottom before the stem cells. You can see 3 months after getting the stem cells, I don't really see it at all on the left side. The right side, that lesion looks quite a bit better, right? So you can still see it, but not nearly as diffuse as it is on the left. And then this is the MRI of him when he had that relapse. And so I'm not seeing anything on the left anymore. You can see the pattern is similar, I think, on the middle and the right, but I feel like the lesions are a little bit brighter. You know, like he's maybe got a little bit more necrosis there compared to what he had. And so he was one that we opted to just try to see if we gave him another round of stem cells and see what happened. And so that was, again, he got even worse before he got that third round of stem cells. And then again, 24 hours after his stem cells, he was almost back to normal. So really marked improvement. And so as far as the cytarabine pugs, these guys are doing great as well. The reason I focus more on the stem cells is, again, just our goal to try to use a different type of therapy that's not immunosuppressive. I will say cytarabine is a pretty wimpy immunosuppressive in that the side effects to it are pretty minimal. So if we're in a situation where either they're not responding to stem cells or you're in an area where you can't get stem cells, you gotta try to do something, cytarabine is a fine option for these guys as well. And so some of these guys came from the STEEP study and just weren't as good responders. One of them is curmudgeon, I'll show you. She's like true to her name, did not want to respond to the stem cells at all. Dozer did well, but only for about 3 months. Spuds was the one who had the bad hives, so we opted not to give her another round. And then Mary Catherine did well for about 11 months before she started having signs come back again. And the other 3 we treated off the bat: Captain Shakespeare, Jupiter Jones, and Beatrice there. And so this is just kind of show you some of their charts as well. So this is curmudgeon. I won't, again, go all the details, but her exam, again, was getting much worse before she got her stem cells. She got a little bit better. You can see the green and yellow dots there, but then got worse again. Got a tiny bit better after her second round, but then she got way worse, again. So she was 2 to 3 weeks after her second round of stem cells, she clearly was not responding. And so we gave her cytarabine and steroids at that visit, and you could see how quickly she dropped by her next visit, got back to normal, okay? And then we gave her, things waxed and waned a little bit, kind of per the dose of her steroid, but ultimately she came down to kind of very stable dose of steroid and has been normal. And then this is Jupiter, so she was one again, was getting quite a bit worse, and then we gave her the cytarabine and steroids, and then took her a little bit to get down there, but she's basically be down and flatline, having no symptoms now for months and months and months. So far summarized with the numbers, we've screened 136 pugs. We want to screen a lot more. So again, this is super simple. We just do an exam. We're just making sure we're seeing how consistently we can pick up on any changes on exam. 14 of those dogs have had signs that we think are of early enemy. Of the 11 pugs that have gotten stem cells and the 7 total that have gotten cytarabine, all of them are markedly improved compared to where they were. And so far we're 3 years into the study, so we're Ideally, having a follow-up time of about 3 years for all of the pugs. Some of them don't want to let go though, you know, where they're like, especially some of the cytarian ones, they just don't want to rock the boat, you know, so, but they're kind of at that cutoff. I'm like, well, we can really try to see how we do, you know, if we got off of treatment. So, but it's an ongoing study. We're probably going to be going on at least for the next several years, you know, we're pretty, you know, pugs into it. So, so as far as how we can help you guys, and so starting with screening exams, I don't know what people's days are like. Does after the talk work for people if we stuck around?
Yes.
Okay, perfect. So we'll set up table. It's super quick. You just do a quick exam. If you're in a situation where your pug is abnormal, we'll go over what to do there. Okay, our ultimate goal is to make it easier for you guys to filter into different places and not have to come to Colorado, although you're welcome to come there. And so for tomorrow, is there a good time? I was thinking like 10 to 2. Is like 9 to 1 better? Is that not good? For kind of similar thing, people can kind of come and go. Raise your hand if 10 to 2 is okay.
It's during judging.
Okay.
Right. So,
Okay. Yeah.
but you're not in the ring the entire time.
Yeah.
Right. So you will have
That's
spaces
what I was
where
thinking.
you
I was
can.
like, we just sit out there.
Yeah.
And that way
Yes.
people are around and you don't
Yeah.
have to, okay. So we're
Yeah.
gonna hang out from 10 to 2 and then come by and we'll do exams. And so as far as the future, you know, what we're trying to do is, I know very difficult logistically to try to have your pugs come to Colorado. How many people are from the West Coast at least? Okay, so at least you guys are closer. When I was in Virginia last year, it was real tough, right?
Yeah.
So as you guys are closer, we did have someone fly from Michigan last year to come to us. But so for people who are close, you know, let's say you had a pug that was repeatedly abnormal and could be eligible for the study, as long as you can get to us, everything is covered funding wise, you know, by the study, it's fully funded. Ultimately, our hope is to have satellite areas where people will be able to go. Like, I can't come here, but I'm gonna go to this person here to help me. I'll be honest, the problem has been finding people to be committed to help, you know, and so we don't want to just pass you on to someone who's not going to take care of you as well as we need. So for some of them, you know, we'll just have the initial stuff at least come to us. And then again, hopefully we long term be able to connect you with someone hopefully for follow-ups and things like that. So, but we're just kind of taking it case by case as they come. So luckily, I will say out of all the screenings that we have done, we have the least abnormal pugs screening with you guys than we do with our normal screening. So you guys obviously have good high quality pugs. So I will say a lot of the pugs that we get, and this is kind of some of the sad thing of people who are not as educated, right, is they're just like getting their pugs off Craigslist or some random person that don't know anything about the disease. And so definitely the breeding, I know, was a lot better in your guys' pugs, and so we're seeing a much lower number of abnormal ones. So, all right. And then if you guys have questions, obviously ask me now. If you're like, hey, I don't feel comfortable asking in front of a group, I'm really responsive to email. Email, so just email me. Yeah.
So they can't have the medication and then have the stem cells. They have to have just the stem cells and then they can go to medication if it doesn't work.
Yes, that's a great question. So they can't have the medication, they can't have the steroids and the cytarabine and then get stem cells. And the main reason for that is that will interfere with the efficacy of the stem cells. And so we have to kind of have it first. And so that is the reason why those 3 pugs did not get stem cells, is we were at that time working with Davis and there was a huge delay in them being able to get cells to us, like by months. And we just didn't have that time to wait. You know, so if we were like, hey, we're gonna get this next week, but we just couldn't wait. And so we started treating those dogs early. That's not an issue at all for us now, so, yep.
Always depressive. So for example, I have a dog that will have mild seizures like once every 3 or 4 months. But he's dying and it's been that way forever.
Yeah.
So I'm assuming that's some other kind of seizure.
That's probably epilepsy, yes. So the question is NME always progressive? Yes. So I think that the rate at which it progresses is going to be different. I think we've recognized it as being this rapidly progressive disease, which as I've been telling you guys, I don't think is the case. I think it's probably going a lot longer than we know. But if you have a dog that has symptoms that are going on for years, especially if they don't develop anything else, your dog probably has epilepsy. It's just one of the uncommon pugs that has. And then, like I said, they do get it. Epilepsy is a very common disease, so unquestionably we're gonna have some pugs who have it. But my issue with it is that a lot of primary care vets just see a young pug with a seizure and say, oh, your dog has epilepsy, without thinking like that's actually not super common in this breed. So, yep. Correct, yes, so all the pugs that are in our study are up to 6 years of age. Yep, to screen. Correct, yes, and I think that's a different condition. So yeah, so that's more of a like pug dog myelopathy, so different condition. But interestingly, and this is kind of a rabbit hole that I don't want to go down, but if you look at some of the pathological changes in pugs that have pug dog myelopathy, they can be similar to some of the pathological changes in some of the lesions with NME. And interestingly, some of the humans, obviously, that have MS can have a progressive paralysis in a slow way similar to pug dog myelopathy. So I'd be quite interested in knowing if there could be a connection at all between those two diseases in some way. They're obviously very, very different, you know, but I suspect that there could be. But it's hard. This is my window, this is my wheelhouse, and then I've been trying to coordinate with someone who is in their wheelhouse, but sometimes it's hard to manage all of that stuff together. But food allergies, yeah. So food allergies are not a symptom of the disease. However, if you have a dog that's living in a what I call a pro-inflammatory state, so allergic to food, your GI tract's upset, your skin's upset. We know a lot with a lot of autoimmune diseases, not just in dogs, people, it's been pretty well established that you develop these inflammatory, we call them biomarkers that are floating around, right? And so I think that can be a risk factor in that you're already inflamed and then it manifests. So a lot of what I think we're gonna find over time is that you have multiple risk factors, right? And those are kind of all come together to push you over the edge. And so what we found, looking at inflammatory biomarkers with a different group of pugs that we did several years ago, a lot of those were older, we actually found kind of an anti-inflammatory pattern. And what was interesting is that a lot of those dogs were over age 9. They clearly never developed NME. Is there a reason why? Maybe because they were somehow being protected a little bit with their anti-inflammatory pattern, right? And so a lot of what the stem cells try to do is reset you to be in an anti-inflammatory state instead of being in a pro-inflammatory state, right? And so again, we figure they're probably floating around in a pro-inflammatory state for months to years before they ever kind of manifest, you know, their symptoms in the brain. So, yeah.
Years ago, I bought a bitch that the whole litter eventually died. One died at 2-year-old, one died at 2 years old, one was closer to 3, one was over 10 years old. Now she was told that dog that was, so we sent all the dogs in to
Dr. Barber.
Dr. Barber.
Yeah.
So, you know, some of them died earlier.
Mm-hmm.
Bitches that died earlier.
Yep.
The one that was older was a dog. So why, I mean, is that what you were just explaining, kind of? Why maybe the older or the dog was died at a much older age?
Yeah, and it might just be there's a range, right? So it's gonna be very unlikely for it to be older than age, but not impossible. So every once in a while you're gonna have one. So there's like case reports of following dogs over the course of like 3 or 4 years and kind of tracking lesions that are not being treated, that are really, really slow. And so again, kind of to your point though, we've kind of pigeonholed NME to be this very specific type of disease that I think we're wrong. I think that there's probably a lot of variance to it. If you look again with those humans with the MS, that pie chart I showed you, we have different variants of disease, right? So potentially maybe that older pug was following a different sort of path than the other pugs did. But obviously being in the same family, it doesn't seem like coincidence, right? That probably similar genetics, similar risk factors maybe that predisposed there, but one followed a different pattern. And it might have been that other things that were going on with those other dogs, you know, other genes too. So you figure with females, we know certain genes that are associated, but females have a lot of other immune genes too. So it's probably a combination of different genetic factors too. And so that's why it's hard. It's a complicated disease process, but be interesting to compare the path though. And if you ever get those, I would love to see it. If they can actually get you the path reports to send over, because it'd be really fascinating to see what did the actual lesions look like and how are they different in a dog that, you know, was much more delayed with onset of signs. So, yeah, yep. Right.
You don't see cases or as many cases for those dogs versus like the dogs in the study are more likely from backyard breeders.
Yeah.
Where nobody's done it.
For sure, yeah. So we know that a lot of them are coming from more backyard breeders, I think, in our population for sure. But the genetics should still be similar for pugs, I guess. You know, so it's hard to know. We have some that we know are still purebred, even if they're not probably the best you know? And so I think what I'm wary of is if you just look at that, if, instead of looking at the low risk, if you look at any sort of risk, so you typically we're looking if you have 1 or 2 copies of that abnormal, you know, genotype, and, you know, we have over half of our population that has that, right? And so that's why it's really unreliable to trust, I think, any of the percentages that you have. So I think still to be safe, I probably wouldn't breed a high risk to high risk, but I don't know, I just showed you we have 26% of our high risk pugs showed any signs of enemy, you know what I mean? And that was not a small percentage of our population, you know what I mean? That was, you're talking about a fifth of your dogs, you know what I mean? So I think it's really, really hard to trust now over time. And that's a hard thing with some studies. Again, it was done by 2 different places, they're reliable, but all veterinary studies are limited by numbers, right? You have small numbers, and so you make statistical conclusions based on small numbers, but over time, you get more and more numbers, right? And then sometimes your perspective shifts, you know, and it may be geographical too. We might be dealing with, you know, differences where we're at. Yeah, I think to be safe, you have to go about doing it that way. But I think what I'm saying, like, my worry is, like, I'm not sure how reliable this is all going to be. But I think what are you going to do? You feel it's a tool. But what I'm saying is, I think if we can, try to shift our screening. And so I think that's why, because if we could just trust the genetics, awesome, right? Because like, oh, I just do this genetic test. That's all I need to do. That's all I need to worry about. But if we're finding that that's not reliable, we need to find another way to screen them, right? So. Yep, you can retest, and it might be too that there's just different genetic things that we're missing. Like that dog that I showed you that had those lesions was an NN, you know, that you can clearly see those necrotizing lesions on the ring. So. So we work with a lab called TGen. So if you guys, there's 2 different labs that have done the genetic work. The UC Davis lab that does that kind of NS system is different, but not so different that they're not reliable. It's different ways to kind of come about finding mutations, right? So the group that we work are the ones that worked with Georgia. So the kind of papers that were published out of Georgia by Dr. Barber, et cetera, that look for genetic risk. Those are the genes that we're using. And so I use the term NS because it's easier for you guys, but we're actually looking for an A to T mutation in a different gene, you know. But,
so it's not using
so we just feel like ours is more reliable, which is why we're doing that. Yeah. So yeah, you could. I mean, it's not part of our study, the funding of our study, to then submit a whole bunch of extra genetic testing in a different way. So that's why we've done, and ours has been pretty reliable, you know. So, but you're right, for you guys, if you're like, hey, I want to see the difference, I've had my dog tested at David's as this, can I submit a sample? 100% we can do that. Yeah.
Your study would mean a lot more to all of us if we knew what those dogs that you were looking at, if they were NN or NS or
She's just
SS.
saying it.
Yeah, I'm just saying it, yeah.
She always in and has the lesions on the head.
Yes, and I know the only puppy I've ever had that died of a, very suspected from KCPE was NN. The only one I've ever had.
Correct, that's what you're following my exact point, is I feel like it's not super reliable. And I think ours isn't reliable, I think our genetics aren't reliable either, as far as determining whether your dog is gonna get it. Because, yeah, the exam is reliable. So I think whatever genetic test you do, I think they're equally okay. We trust the one that we do, but I don't trust that ours is predicting dogs are gonna get enemy either. That's my point, yeah. So, yeah.
A bitch, a black bitch, Pinky.
Yeah.
That is 15 plus markers, Indian markers.
Yeah, I know. It's just like, yeah, I know. So I think we have to get reset it instead of saying, I'm just going to genetically test, say, as soon as my dog hits 4 months of age, I'm going to recommend getting screened by a neurologist. That's what I think we need to do. And just get regular screening exams. They're cheap. They're easy to do. Get screened every 3 months, every 6 months up until you reach 6 years of age, and then you're probably in the clear. That's what I would do.
So what you're saying is that the physical, the neurological exam at a certain age could be used as a breeding tool.
Or at least as a screening,
screening
test, yeah. Yeah. Just, Yeah.
What Debbie said.
She was asking if the neurological exam could be used as a breeding tool, so again, I want you guys to think that there's different facets, right? And some, but I think the neurological exams are a lot more reliable from what we've seen. And I showed you guys the one lesion, but we've seen it in all the dogs, that they have lesions in the brain that don't make sense to be anything else, so, yeah.
Can you explain what the neurological test is?
For sure, yes. It's like, so if you guys have ever been to the vet and just had a physical exam where they listen to your heart and feel your belly and all that stuff, all the neurological exam is it's testing certain neurological functions. So how well are they processing blinking? How well are they processing their feet in space? How do they feel? You guys saw me do that palpation. So it's real quick and easy, but it's just screening for certain things. And a lot of those are based on the processing that's going on in the brain. Is it processing vision? Is it processing, foot placement? And with this multifocal pain, to me, that's probably something that's indicating an inflammation in the meninges going up and down, trying to something more of a diffuse inflammatory thing. And so we don't notice that as much when they're later and more progressed stages of disease, but they're also really out of it, seizing. Sometimes I think it's really hard to tell. But I think you have this period of time where you're inflamed. They see this in humans with MS too, and then the lesions progress, right? And then they get worse and worse and over time. But some of the changes might be different. They might not necessarily have the same symptoms later on that they're having with those early symptoms. So, yeah. Yeah.
So 2 questions. So you said we can submit samples to the lab that you guys are using.
Yep.
Correct?
Yeah, honestly, if you guys submitted samples,
I mean,
like if we did an exam on you guys, let's say, we did an exam on your pugs,
Yeah.
if you had samples already submitted to UC Davis, or you submit them, and then you can, with your local vet or something, ship blood to us, we can do the genetic testing. Yeah, and we'll have already done your guys' neuro exam, so you're part of the study, that's all covered by the study. And then if you have the results, I can say this is what we're coming up with, if you want to do that to compare.
It has to be blood, can't be swabs.
So I will check. I checked with Matt. I'll check with him again.
It's gonna be you're gonna get a lot of more people.
Do
saying
swabs, yeah.
Yes,
Yeah.
for sure.
It's just the blood is a lot more reliable for what we're looking at with
Oh,
the DNA.
I
But
know.
I'll find out. I asked him last
It's just
time
that
if
we
we could
have
do
to go
swabs.
to the vet and
Yeah,
bring
for
the
sure.
dogs. And,
I will get back to you guys on that because I thought about that as part of it here. Part of the problem is that we have a study that's all done blood and we know that's reliable. So we're a little bit worried about switching to something where maybe the sample's not going to be as reliable.
Right.
Is that whole blood?
Whole blood, so purple. So if you went into your vet, and we don't need a lot. So and then you could just
And it
freeze.
doesn't need to be refrigerated, right?
It needs to be frozen, so
It
you would
has to
just
be
freeze it
frozen.
to us. So you just send it to us on dry ice and we'll
Okay.
take it.
And the other question that I had, so let's say that you're gonna breed pugs right now, okay, as with all your knowledge. So you have dogs, so what would you said you would start at 4 months old, you said, a first neurological exam. And then you would continue, like, have once every,
I would probably do every 3 months, just because I'm like super cautious.
Right, but like
Yeah.
put it in a practical way that somebody can actually say, you know what, I wanna use this dog, is, I don't know,
Yes.
2
Yep.
years old or whatever, like
Yep.
something like that. What would you think would make you feel more confident that
Yeah.
these dogs are,
I think if you start doing exams and you screen them every 3 months, 3 years, it's hard because you breed them when they're young and
Right.
they can still kind of get it to a certain stage. I'd say most of the time, again, by 1.5, 2.5 years of age, that's the kind of prime time most dogs will start showing symptoms already. Out of the dogs that we have had, and we've gone up to age 6, I think we've maybe had one that was 5. Everybody else was like 2 or younger that started showing signs. Yeah.
So, but this neurological exam is particularly something that you would do, but would other
Yep, any neurologist can do it.
They can do it.
Yep. And most people have heard of our study because I speak at national meetings. If they haven't, just email me and I can email them directly, like, hey, do you mind doing the exam? So.
Okay.
I knew about that for a long time. Yep.
That was actually my question, is are you going to have a standardized neurological exam
That-
recommendations that we could just take to our neurologist? and
Sure.
say, "Hi,
Can you do this? Yeah.
Yeah.
Submit it to them? Like,
Sure, yeah, and the neuro exam, at least that's consistent for everybody. I mean, I will say, I'm really, really careful with how I do my exams, and I'm really meticulous. So the hope would be someone is gonna be that same way, you know, and pick up on things and really take the time, because a lot of pugs are like, don't touch my feet, you know what I mean? So you gotta like really
Right.
kind of get still and, you know, to really be able to, I feel like the hardest part of my job is doing the exams. They're so quickly, you know, so, don't touch it. So, yeah, exactly, yeah. And so if you, but if you say, I wanna just start getting screening exams, and if you can just say, we have 4 publications on this, if you say, you know, I heard Dr. Windsor, you know, I wanna make an appointment, do you wanna contact her or contact me and I can email them or whatever, yeah.
And every 3 months is kind of, you know, hard.
Yeah, you can do
Like, let's
6,
say, I don't
yeah.
know, 10 dogs every 3
Yeah,
months.
you could do, you could even try to do 6 months, yeah. I look at mine every 3 months if they're high risk, I would say
Right,
too,
right.
but, yeah, so you could try 6 months too. Yeah.
Is it unheard of that a neurologist, no matter where she is practicing in the country, would have heard of NME?
It would be very unusual for them to not have heard of it,
Right.
yes.
Okay.
Yeah. GME, that's a really great question. So GME, or granulomatous meningoencephalitis, is a different autoimmune disease that pugs also get, but it's different. So it, yeah.
His temperature spiked to 107.
Mhm.
So is that GME, is that normal for GME?
Nope, that's not normal GME. Yeah, but sometimes if they've had like a seizure or something, but yeah, that's not normal. They can have a fever. 107 would be very atypical for a fever. But to your point, you know, when we're talking about different things that can cause seizures, I would say most of the time NME affects that front part of the brain, which is why seizures are so common. GME tends to affect the back part of the brain. So more common balance issues, falling, weakness, neck pain. Yeah, they can both be pretty fast, but GME can be very fast. Yeah. So, but it's, and again, we know.
He had a seizure, temperature spiked to 107.
So, how do they know it was GME? Did they?
Sent him away.
Okay, so, okay, to look. So, yeah. And so this is a good point though, that these are all like histopathological diagnoses for a lot of dogs. Usually on the MRI you can tell the difference because like the necrotizing lesions look necrotizing. Usually where they are, they're different. But not all pugs that have seizures have NME, you know. Yeah, and GME can be really rough. Yeah, and GME can affect much wider age range. Yep.
My regular vet, when I bring my litter puppies in for their checkups, they do a neural exam on them.
They can, yeah, if they feel comfortable just doing it, just they do feel comfortable doing their own neuro exam, yeah. You know, and you could say, hey, this is what we've seen are these risk factors. I will say again, it tends to be like, you know, because it's what I do every day, you know.
Right,
Right.
you know where you're
Most people are going to be, you know, so I pick up on things all the time on neuro exams that other people didn't pick up on because they just don't do it as often. So, but you could use a screening. Yeah, as a screening.
When I brought older dogs in, they'll do the foot lifting thing, and she watches that. She's never done
Medicine, all that. Yep.
next time I have litter, I am gonna ask.
Yep. To start screening all of them. Yep. I would wait a little longer, yeah, because it takes a while for all those reflexes to develop. So if you're too young, they won't have a normal blinking response and stuff like that. So, and our youngest pug was 3.5 months that had early NME that we started treating.
Oh, wow. So another thing is, so to diagnose this, necropsy or an MRI?
Necropsy. It really
Necropsy.
has to be necropsy. Yeah.
So
and that's part of the problem that we have, right, is that, and this is some of the pushback that we get,
Right.
which I totally understand, is like, how can you say that this is NME without necropsy? I'm like,
Okay.
well, I can't, but I'm not gonna let them get there, right? So the alternative is, okay, we think this is what it is, let's just see what happens if we don't do anything. So we haven't done that with anybody.
So it has to
Yeah.
be necropsy?
Mhm,
No,
mhm.
okay.
Yeah, it has
Because
to be.
some-
You can be very suspicious
heard-
based on MRI.
Right,
but-
like we heard with an MRI, this is this or whatever.
Yes,
that's what
I mean, some of them, like, I can't imagine what else it would be, you know, it's
Right.
really pretty classic, but for some of our early ones, you know, you're like, I really feel like this has to be it,
So if
but
a
we
dog
never
passes
know.
away, it has to be necropsy.
Correct.
Yes,
Mhm.
that's-
Yeah, and all of our dogs will be necropsied ultimately, but we hope that they're very far from that.
Yeah.
So, yeah.
Well, we live, a lot of us live in real rural areas, and we don't have neurologists.
Yeah,
Is there
for
some
sure.
kind of step that we could use in an area where they could be trained to at least give you a
Yep.
step to say you may
Sure.
have an issue?
Yep, I feel like all regular vets are trained to do neurological exams in vet school. So it's real, so you could just say, hey, but they don't always do them. especially if dogs are healthy. So you could just be like, hey, in addition to my general exam, can I have a full neurological exam on my pug? You know, it was recommended that I start getting these screening exams, you know? So,
that's good.
and then you can even tell them too, hey, these are the things can you particularly look out for, the blinking, paw placement, you know, the neck and back pain.
So is that something that you can probably send us or something so we can have it
Yeah,
and maybe share with
absolutely.
the kids?
Yep, and I just do a summary of like, hey,
Yeah.
absolutely. We can make you guys like a new flyer that's like, hey,
Yeah,
you just share it with everybody of like, this is what's recommended. So, yeah.
Well, even as breeders, we watch our puppies very carefully. Is it something that we could try? If I'm gonna place my puppies for 10 minutes minimum, and I try to educate people as to what she was doing. But if I have a puppy, and I watch them, if I see something that I'm uncomfortable with, then I'm gonna go right to them.
My suspicion is you probably won't pick up on it when it's subtle in the early stages. So you could try, but it's kind of an art to it that you know, yeah. There's nothing wrong with trying, but other things would be noticing, like, you know, some of the things we talked about, like lethargy, vision loss, like this, like such a sad story of a pug that died of NME, and this is one of the reasons we got this started. They've actually done a lot to fund some of our studies where she had been taking her dog in and out of the vet for months because she felt like he was circling, you know, and it was subtle and it would go away and then it would come back and he had NME the whole time. It's treated for ear issues, you know, so I think just being advocates of like, hey, this is off, and I think that not letting yourself get blown off, right? Like this is off, something is wrong, this is subtle enough, this could be going on, because in the beginning stages it's really subtle, you know. So
And then maybe we can get something done with like, I mean, let's say that somebody, I don't know, has a dog that is acting strange or something and it doesn't live close to you or whatever, they might want to be, because I mean, really, if I have to go and fly to Colorado, it might be, if you said that they are funding everything, right? That they are doing the stem cells and all that, like if
Yeah.
I have to get my pug and go to, I don't know, the university or something like that and, you know, treat it, it probably would be better just to go to Colorado. And
that's
get a
kind of
hotel.
what my
Yeah,
suspicion
just
is,
saying.
yeah, what I've said. Because for a lot of people, like, I want to go somewhere close, but if you think about the cost for someone else to
Right.
do the MRI and spinal fluid, it's going to be way more than a flight.
So maybe we can have like
Yeah.
a something to, like a contact information, something in
Yep.
case something, you know.
It's
so-
just me. If you have
so
anything
just
that comes
you.
up, just email
But
me.
what
We
about
have dogs come
like a
from
pet person that has a,
Yep.
you know, a pug, for example? Would they be the same thing, like contact you to, you know?
Yes,
if they were-
anyone would contact me, yeah, and we'll
Anyone,
kind of get them
okay.
in, yeah. And then we also, I can give you guys information for our liaison, Chelsea, she's the liaison for our studies. So when I send you guys like the information of like what to do for screening, I can give you guys all that contact. But pretty much like, yeah, that's my email, just contact us. And we've had people come from across the country.
Right,
you
I know that,
Mhm.
right.
Yeah. And again, yeah, you have to pay for the travel, it's a little tricky, but then, you know, I'll be honest, at the end of the day, we're probably talking about $12,000-$14,000 in treatments. that are
Right,
going.
right, that's, because, I mean, how much is one of those stem cells?
2,000. Yeah, so if you take into account the MRIs, the
And
repeat
MRI is
MRIs,
2,000 or 3,000, right?
5,000. Yeah. So you're taking into account the MRIs, repeat MRIs, the stem cells, it's a lot. So, yeah, and then I've selfishly wanted to be me so it can be consistent, because I trust that, you know,
Right.
doing it right away. So. But again, at the end of the day, we're trying to cure disease, we can't just cure it in Colorado, you know, so
No,
we just have to have
and
people who
the
want
more
help.
pugs that you're gonna see, the better it's gonna be.
Yeah,
I mean,
yeah.
yeah.
Any other questions, you guys? But if it comes up, feel free to email me. You know, like I said, I'm very passionate about this. I'm very committed to doing this. I know it'll take us a
She's
while.
very good answering. Thank you
You're
so
welcome.
much.
Yeah, of course, yeah. And then we'll set up out here, and just like if you guys want to bring your guys by, we'll just do the exams real quick, and then we'll be here tomorrow and stuff too. So.
And just-